Irritable bowel syndrome is a very common and often misunderstood condition that affects millions of people around the world. If you have ever suffered from digestive problems like stomach pain, bloating, gas, diarrhea, or constipation, you might have wondered if you have IBS. But what is IBS exactly? How do you know if you have it? What causes it? And most importantly, how can you treat it and live a normal life? These are some of the questions that we are going to answer in this video, so let's get started. So, what is irritable bowel syndrome? IBS is a common disorder that affects the stomach and intestines, also called the gastrointestinal tract. It causes symptoms like stomach cramps, bloating, gas, diarrhea, and constipation. These symptoms tend to come and go over time and can last for days, weeks, or months at a time. IBS is a chronic condition that you'll need to manage long term. There are different types of IBS, depending on the main symptom you have. For example, if you have mostly diarrhea, you have IBS-D. If you have mostly constipation, you have IBS-C. If you have both diarrhea and constipation, you have IBS-M mixed. And if you have pain without changes in your bowel movements, you have IBS-U unsubtyped. What causes IBS? The exact cause of IBS is not clear, but there are several factors that may play a role. Some of these are: number 1, muscle contractions in the intestine. The walls of the intestines are lined with layers of muscle that contract as they move food through your digestive tract. Sometimes these contractions can be too strong or too weak, causing gas, bloating, diarrhea, or constipation. Number 2, the nervous system. The nerves in your digestive system may be too sensitive or send wrong signals to your brain or intestines. This can cause pain, discomfort, or changes in your bowel habits. Number 3, inflammation. Some people with IBS may have inflammation in their intestines due to an infection or an immune reaction. This can make the intestines more irritable and prone to spasms. Number 4, gut microbes. These are the bacteria, fungi, and viruses that live in your intestines and help with digestion and immunity. Sometimes these microbes can be out of balance or overgrown, causing symptoms like gas, bloating, or diarrhea. Number 5, stress. Stress can affect your brain-gut connection and trigger or worsen your symptoms. People with IBS may also have anxiety or depression that can affect their mood and quality of life. Number 6, food intolerance. Some people with IBS may have trouble digesting certain foods or ingredients, such as gluten, lactose, fructose, or FODMAPs. These can cause gas, bloating, or diarrhea when eaten. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Now, what are the symptoms of IBS? Well, the symptoms of IBS vary from person to person and can change over time. The most common ones include abdominal pain or cramping that is related to passing a bowel movement, bloating or gas, diarrhea or constipation, mucus in the stool, and feeling of incomplete evacuation. Some people with IBS may also have other symptoms such as nausea, heartburn, headache, fatigue, and back pain. So how do you know if you have IBS? Well, it is not as easy as it sounds because there is no definitive test for IBS. In fact, many people with IBS go undiagnosed for years because they don't seek medical help or they are misdiagnosed with other conditions. Still, the first step is to see your doctor and tell them about your symptoms and how they affect your life. Your doctor will start with a complete medical history, physical exam, and tests to rule out other conditions such as celiac disease and inflammatory bowel disease. After other conditions have been ruled out, your doctor will use one of these sets of diagnostic criteria for IBS. Number 1, type of IBS. For the purpose of treatment, IBS can be divided into 4 types, based on your symptoms: constipation predominant, IBS-C; diarrhea predominant, IBS-D; mixed, IBS-M; or unclassified, IBSU. Number 2. Rome criteria. These are a set of questions that ask about the frequency, duration, and characteristics of your abdominal pain and bowel habits. These criteria include belly pain and discomfort averaging at least 1 day a week in the last 3 months. This must also occur with at least 2 of the following: pain and discomfort related to defecation, a change in the frequency of defecation, or a change in stool consistency. If you meet the Rome criteria and your doctor has excluded other conditions, you will likely be diagnosed with IBS. However, some people may have IBS without meeting the Rome criteria, and some people may meet the Rome criteria without having IBS. Therefore, the diagnosis of IBS is not always straightforward and may require some trial and error. Your doctor will also check if you have any other symptoms that might indicate a more serious condition, such as onset of symptoms after age 50, weight loss, rectal bleeding, or fever. Other symptoms that may indicate a more serious condition are nausea or recurrent vomiting, belly pain that isn't related to a bowel movement or occurs at night, or diarrhea that is ongoing or awakens you from sleep. If you have any of these symptoms, or if your initial treatment for IBS doesn't work, you'll likely need more tests to rule out other causes of your symptoms. These may include: Number 1. Colonoscopy. Your doctor uses a small, flexible tube to examine the entire length of the colon. Number 2. CT scan. This test produces images of your abdomen and pelvis that might rule out other causes of your symptoms, especially if you have belly pain. Number 3. Upper endoscopy. A long, flexible tube is inserted down your throat and into the esophagus, which is the tube connecting your mouth and stomach. A camera on the end of the tube allows your doctor to view your upper digestive tract. Number 4. Lactose intolerance tests. Lactase is an enzyme you need to digest the sugar found in dairy products. If you don't produce lactase, you may have problems similar to those caused by IBS. Number 5. Breath test for bacterial overgrowth. A breath test can determine if you have bacterial overgrowth in your small intestine. Once you have a diagnosis of IBS, you can start treating it and managing your symptoms. The treatment of IBS depends on several factors, such as your type and severity of symptoms, your triggers and preferences, and your response to previous treatments. There is no one-size-fits-all solution for IBS, but there are some general guidelines that can help you. These include: Number 1. Lifestyle modifications. You and your doctor will try to identify and avoid foods or drinks that trigger or worsen your symptoms. Common triggers include dairy products, gluten, beans, cabbage, broccoli, cauliflower, alcohol, and caffeine. You can also eat smaller meals more often, drink plenty of fluids, exercise regularly, get enough sleep, and reduce stress. Number 2. Medications. Depending on your type and severity of symptoms, your doctor may prescribe medications to help you. These may include antispasmodics to reduce cramping, antidiarrheals to slow down bowel movements, laxatives to ease constipation, or antibiotics to treat bacterial overgrowth. So, these were the most commonly used treatments for irritable bowel syndrome. Now, what do you think? Did you experience some of these symptoms before? Were you diagnosed with irritable bowel syndrome? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.